Welcome, everybody. I'm Jeff Lemon with Christina Chambreau and Gail Pope. Christina and I are both certified licensed veterinarians. Gail is the founder and runs the Bright Haven shelter in California. We're here today to talk a bit about making the best decision for your pet that may have a cancer diagnosis. And today's topic is really not about cancer per se. It's about disease in general, but cancer is certainly, a name, a word that sets off a big, strong emotional reaction in a lot of us. And Gail, would you mind saying again, what you said before I started recording as far as the importance of today's topic and what you're doing?
Well, actually, yes. I was just thrilled when you announced today's topic because I do a lot of consultation work, and it's the topic that comes up over and over and over. Almost every consultation, even if it's, and I really appreciated you saying it's not necessarily about cancer, because it's an out of balance state. Cancer could be any one of a dozen other illnesses, and it's really about bringing the being back into a balance, easing the disease. And so I just think it's really important. We're facing one of those situations at Bright Haven, and it made me think this morning that I'm often asked about cancer, and yet it's something that I'm not terribly familiar with. It. I mean, it sounds strange, but the animals who live with us as part of their lifetime, they don't develop cancer most often. We've had 2 cases of, vaccine sarcomas on the back, and we've had a couple of squamous cell carcinomas in the mouth, and that's over like 20 years. The only cancer that we've actually dealt with has been pre-diagnosed in an animal who has come to us having already been treated, which is very different, and which to me underlines the fact that if you work holistically with your animal, maybe they won't even develop these nasty things. Would you agree, Christina?
Well, they're certainly a lot less likely to. I mean, it's so important for everybody who is doing what we're talking about, and they think they're doing the right thing. It's so important for everybody to know that there is no one right thing. And so animals and people do sometimes get ill at young ages, do sometimes develop cancer, simply because of the environment that we live in. And, you have a very nurturing, but also environmentally stable environment. So the animals who don't have cancer coming into you, are not likely to develop it.
I also have to say,
people who are out in the general living are, they're traveling a lot. They're going to and from work. They may be bringing toxins home. They may, even doing their very best. They may be living near a fracking area. They may be living in western Wisconsin, where they're digging up sand to use for fracking. And so thousands of acres of farmland are now being turned. So so different people, depending on where they live, may have issues with things that would cause problems. I think, though, the biggest problem that I see, and it came up yesterday in 2 people who called me for consultations, is it really is the fact that you're not doing conventional veterinary care, that you're doing holistic. Because so many people who were clients of mine or of other holistic veterinarians, completely cured of an issue, whatever the issue was, often a serious issue, with homeopathy, and then their dog or cat starts to vomit or have diarrhea. And for some reason, they don't call us. They go to the conventional vet for that. or maybe they see a lump and think it needs to be taken off, so they go to a conventional vet for that. That at that age may start a whole cycle of going downhill, which may result in cancer. So there are 2 points. One is doing everything you think is right. Your animals still may get cancer. That's possible. It's much less likely, much, much less likely. And 2 is that when you intervene during the lifetime using conventional medicine, it predisposes them, it weakens the immune system, so they're more likely to get cancer.
I think Gail brought up a couple of really important points that we need to kind of take a step back, because Christina, I think that you're at the point there where the animal has already developed cancer, or what to do with any symptom. And I think it's very important to point out what you said at the beginning, which is that we're all exposed to cancer, carcinogens, to causes every day. I mean, and this is now a medical fact. All of us have cancer cells in our bodies, yet the majority of us, at least when we're younger, don't develop cancer. So the question, as Gail, I think you pointed out very well, was, are they not developing cancer because we were able to foster and keep them as healthy as possible? And was the environment, such as the nurturing, loving environment in Brighthaven, is that part of the reason you're not seeing the kind of cancer diagnoses that we're seeing in the general population? I think that it is. I think there's good evidence that the environment, the emotional environment, is a big part of the cancer diagnosis. But the real question is where to start. First of all, let me ask you both. It's almost 50 years since Nixon declared a war against cancer. Did we win or make any headway in the war?
Well, wars, I'm anti-fighting, so I don't believe in fighting. So that the war against drugs, the war against the world, the war against anything.
Exactly. That's exactly why I brought that up. Is
if an animal gets cancer when you're in the process of building health, you just simply keep doing what you're doing, and you tweak it a little bit.
Let me just say something there, because it really brings it home to me. When I say we don't see much cancer in our animals, maybe it's there. Maybe, we don't go looking for these things. And as we're treating with homeopathy, as little symptoms and things manifest, they get put into the picture, and we carry on with general daily life treating them homeopathically. And so who's to say that we haven't all got cancer? We've all got, the potential for the cancerous cells in our body, and they just don't necessarily develop. Or even if they do develop, then it's a matter of coming in and out of balance. But then obviously, as we have at the moment, we took in a new girl recently, and she has what could be a pretty aggressive cancer on her eyelid. And so we're faced with a decision that isn't the kind of decision that we normally are faced with. Of course, we're working with homeopathy, and we're trying to bring her back to balance and a little bit better health before we step in further down that road.
Well, you've got a young pet, you've got a young kitty or a dog. You want to avoid, or you want to do everything that can possibly prevent cancer later in life. And Debbie asked about, well, what about people that buy golden retriever puppies or Bernese Mountain Dog puppies, or breeds that are predisposed to cancer? So, the best place to start is definitely when they're young. And we're going to go back to every week that we've been here, harping on the same things over and over again, which is the healthy lifestyle, good diet, minimizing vaccinations, minimizing drugs, and most importantly, like Christina said earlier, how you address or how you approach the individual symptoms. No matter what the name of symptom. You know, a cancer diagnosis, you know, is one thing if it's a little, you know, well, I guess the real question is, what are we calling cancer? Cancer any growth on the body? Is cancer a malignancy, a malignant growth? Is cancer, you know, just based on its cell type? If you've got a little wart that when biopsy comes back as a mast cell tumor, is that cancer? It's now 5 years later, and that wart.
I
was gonna say,
yeah.
it goes up and down. It gets bigger, it gets smaller, but it doesn't do anything. Yet it was diagnosed as cancer. Is that cancer? Christina, you're going to comment.
Well, you know, I actually didn't treat cancer. I referred pretty much all my cancer cases because when they were being treated homeopathically, they needed really good follow-up, and I'd often be away teaching. For me, I guess cancer would be malignancy or a malignant growth, not just any growth. I mean, even conventional veterinarians call them benign growths. So this is Ed, by the way, for everybody who's watching me pet my cat. He's not ever been around for any of the other blabs, so I'm taking advantage. I guess it's the rain. He doesn't want to be outdoors. So what is cancer is a really good idea. I mean, a really good question. I guess it's cells that are out of control, cells that are not behaving properly would be the closest. And Jennifer commented about, is cancer a natural, you know, does cancer appear in the natural state? And I just heard on NPR this morning, amazingly, given the topic of our blab, that scientists have now identified cancer in the bone, in the ankle bone of a 1.9 million year old fossil. So cancer was present almost 2 million years ago. Now, I don't know how they define cancer, Jeff, but they called it, they actually said what the cells were.
But do you think that caveman knew that he had cancer? Do you think he had a cancer diagnosis? Do you think they did a biopsy? You know, I think that's, you know, very important to realize is that is the recognition and the naming of the disease that can actually do in some cases more harm than good. There's a lot of good evidence that, you know, the panic state, that the getting tied up in the name of a diagnosis, let alone cancer, which is a horrible, horrible diagnosis for most people, that the emotional state and the emotional milieu, the environment that you're living in, is going to have a huge impact on the course of the cancer. There are so many, and Gail, I think your animals are beneficiaries of this. There are so many situations where they're diagnosed with cancer, but the cancer word is never ever used readily in the house, in the home, and the animal is just treated like any other animal with a growth or with a wart or with a bump, and they can go on to live normal lives. And I think that's really what it's all about, is what is the quality of life of any animal, of any person, of any being with any diagnosis. I mean, you can get a diagnosis of a skin disease and have a horrible quality of life based on the fact that you have a diagnosis, a name that you don't like. You know, maybe you're a dog or a person with a kind of sarcoptic mange or other infectious disease, and you're worried about spreading it on and on. But the reality is that as long as you support your body and don't panic, that you're going to have a better long-term outcome, and a better quality of life in the interim. And your animals, Gail, are great great examples of that, and I think Ellie is going to be a great example of that. You've had it.
Okay, that brings up a really good question, which is one that I'm dealing with at the moment, and I know a lot of people do. We completely believe in the holistic philosophy. We don't name we very often don't do diagnostics with our animals because we don't feel we need to have a name for it. Now, in a situation like Ellie, I haven't done diagnostics. She hasn't been with us very long. And in all honesty, it's a classic case of what it is. I mean, you've only got to look at her to kind of know almost instantly, without a huge amount of veterinary experience, what she's dealing with. Now, the question is when one of your animals develops a tumor, a mass that is growing fairly quickly, and it's in an area that is very invasive, then you're dealing with something different, because you know that there's a possibility you can bring them back to good health. However, if that tumor is going to destroy another organ before you achieve any balance, then you have to start looking at surgical intervention and whether it's the right and appropriate thing to do. So I'm really interested in your comments on that, both of you.
Sorry, I'm just
Go for it, Jeff.
writing something there. So, Gail,
My answer first is that it depends on your faith in homeopathy. And it depends on who you're, working with. I have seen animals that had cancer that went away quickly. I've seen animals that people chose to stick with homeopathy and not do anything else, and they died. I've seen animals, and that's true whether it's renal failure or hyperthyroidism or other issues. I know one of the wonderful leading human homeopath who got breast cancer, and she gave us a nodule in her breast, and she gave herself 1 month of homeopathic treatment. She said, if it's not changed in a month, if it hasn't responded, I haven't changed at all. There's been the remedy has had no impact. Then I'm going to do surgery, do a lumpectomy. And she did a lumpectomy, and that was 15 years ago. And, she continued to treat herself homeopathically and has gone on to do fine. James Kent basically said in the early 1900s that he so believed in the power of homeopathy to be curative, and so believed that if you did anything else, that you would be sentenced to a life of horribleness, that he would rather have somebody die under homeopathic treatment than go for any allopathic treatment. And that was just his faith in that. And Dr. Pitcairn tended to be that way a bit too, although I don't know he would have said that. But he would treat even when it looked like this isn't going to work, and then sometimes it didn't work. And it was just his faith that this is the only way to do it. So I'm much more, I've seen enough that don't work that it is a big conundrum to me. And it does sort of have to do with where it is and what the conditions are.
And Gail, that's exactly what I would say, is that it really depends on the individual. It depends on the speed of growth. It depends on location. There are definitely some situations where waiting even a couple days can be catastrophic. But those are frequently end-stage situations. Animals and people have had other quote-unquote unrelated problems that they're ending up, with a cancer diagnosis. So what seems like rapid growth and rapid development is actually something that's been going on for a while. However, that being said, if it's involving the eye, and are you trying to prove it's the squamous is around the eye?
It's on the upper eyelid and the lower eyelid. It kind of wraps around both eyelids.
And Ellie is about how old?
Hard to be sure. I would say 14 to 16. Good health other than this. Her blood work's not bad. She's very strong emotionally. We're also working with a medical intuitive who's been helping us enormously from the point of view of looking at remedy responses. And we've seen both improvement and non-improvement. At the moment, Ellie tells us that despite the fact that we're concerned, that she's actually feeling better and she can see healing in the cells deeper inside. So it's very difficult. It's difficult to trust yourself to be in charge. And as you say, Christina, some make it through, and we talk about the miracles of healing that we've seen, and others don't. And then we face a different discussion with ourselves. Did we, should we, could we? What was the right thing to do? And everybody's faced with that once they're sat across or stood across the table from their veterinarian who says, there's no hope. Then they have to start those kind of questions. What is the journey ahead, and what could I do? What should I do?
And that's concerned.
The other thing is, with an eye problem, I mean, at worst,
yes,
you take the eye out. If it doesn't respond to homeopathy, I mean, cats do great with one eye or no eyes. So, and we know that. So I guess, for me, it would be the level of commitment that a person has, and the feedback from an intuitive, the feedback from an animal, if you feel it's accurate. I would use those two things more than the fear of,
right,
God, we're going to lose an eye. For you, for instance, it's like you see the love, you interact with animals from who they are in their spirit. You don't even notice they don't have an eye. I notice, unfortunately, but you don't. That's the joy of, that's why you're one of the reasons you're so successful. So for you, I would lean towards not doing surgery, and unless she says, hey, I'm tired of this, get it out.
Well, that's the journey we're taking at the moment, and we're early on in the journey, although she's, the tissue's really friable and it bleeds very easily, but she's eating really, really well. She's still settling in and getting comfortable in her new home here too. So we're just taking it day by day and going in the right direction.
And you have or you have not seen any big changes since she's been with you?
We have seen a little improvement. We've also seen it worsening. The tissue above the eye has changed and is probably a little worse. The tissue below the eye, the swelling went, we've seen it kind of come up and down, and we've seen it change. And just when we thought it looked worse, Ellie tells us that she actually is feeling better. So, we're relying on what we can do in daily life and what her veterinarian can do in prescribing the right remedies. He's staying right on top of it, and we're checking quite often just to know we're headed in the right direction and to change the remedy if necessary.
And that, I think, is the key to a successful long-term outcome, is to initiate your treatment with homeopathic care. Initiate it at the energetic level. Get the body as geared up as possible. And of course, at the same time, do everything you can to control and improve the environment, whether it's the diet, whether it's, just loving, nurturing with the people in the home, whether it's, making sure that no one is smoking in the house, all those things. But most critical is to start treating homeopathically. If you're seeing some improvement at times, even if it's up and down, you're probably on the right path. If, however, like with the example that Christina gave, if it's been weeks and you're not seeing any improvement on any level, and yet it's the growth is potentially in a bad spot, or is getting gradually bigger, it's or bleeding and causing, problems because of, just the fact that it's bleeding all over the place. And the fact that you've started treating him in advance and then has surgery to remove the mass for whatever reason and continued treating him with homeopathy, I think that gives the longest and best outcome for any of the cancers. And Christina.
Yeah, and just think for a moment about different ones that you know. Like, for instance, I had a small poodle, a toy, I think it was, maybe, I don't know, mini, who was 12 years old and was diagnosed with a hemangiosarcoma on the spleen. And the worry about that tumor is that it'll pop and bleed, and the dog will bleed out and die. And she chose to treat homeopathically, and it did bleed several times, and she went in and had it tapped. We used homeopathy predominantly, but anytime she felt the abdomen started growing larger and either I wasn't available or, she felt she needed to do something before she could talk to me, she would give a couple of pellets of Yunnan Bio, which is a Chinese herb that stops bleeding, and it can also be used topically. And she went on and lived to be 20, and I forget what she died of, but it was not the hemangiosarcoma. And the tumor stayed on the spleen. On follow-up ultrasounds, it was still there. It never went away, but it just didn't. Her health was such that if it bled, she was able to stop the bleeding herself internally, because it was only like maybe in 10 years, it was only 2 times she had to use the Yunnan Bio, or 3 times, not often. I had another dog that had came to me, yellow lab, with hemangiosarcoma of the skin. And it had already had surgery 3 times. And so she was going to do no more surgery. The dog was now 12. The dog's quality of life was poor, low energy, not feeling well. But this was the love of her life. She was now married and had a child and had a live-in Spanish maid, Mexican maid, and all of them wanted her to put the dog to sleep because it was bleeding all over the white carpets in her house. And she didn't want to put the dog to sleep, so she came to me. So I was already sort of starting under a little bit of a handicap here. Went on to treat the dog, and within the first few weeks, the dog was entirely back to her healthy, active, wonderful self. We never did manage to get rid of the tumors. We even weren't able to keep them from bleeding all the time. So I wasn't able to cure this dog, but it had had a lot of surgeries ahead of time. But the dog lived another 2 years of really high quality life. And then at some point, she was ready to let go. And the next time the dog started bleeding, she put the dog to sleep. So that's just 2 examples of what can be done.
A
Jeff,
lot of examples, but that brings up a great point that prognosis, the odds of a condition improving are directly proportional to the amount that we're willing to tolerate the symptom. And if they had been willing to tolerate the dog bleeding all over the place, probably would have kept on living.
Right.
And that is true whether it's a skin.
Yeah, the dog was also not responding very well. It was getting lethargic, was showing some secondary thing. It was probably fine. I didn't feel badly at all about that. But yeah, go ahead, Jeff, with some that you've completely turned. Well, I guess I'll think of one more. This was a cat who developed a vaccine fibrosarcoma on her side, and it got very, very huge. And the owner, I actually had suggested surgery because it was growing and wasn't responding that well to my prescribing. But the owner waited a long time, finally did surgery, and they had to resect the ribs and do some grafting, and yelled at her and got angry with her because she had waited so long, and told her the cat would need to be on pain medication the rest of its short life, and sent her home on heavy-duty pain medications. She gave no pain medication. She used just arnica after surgery, and with continued homeopathic treatment, never had the tumor come back, and the cat lived another, I don't know, 5 or 6 years, dying in the early 20s. Even with surgery, so that's a point to what Jeff was saying, that you can do surgery if you've been treating homeopathically and then continue to treat homeopathically.
And that's a great case, because that rarely is the outcome in those situations. Vaccine-related fibrosarcs, are so aggressive and so recurrent that I don't even think that most of them live 6 months or a year, let alone years afterwards. So that's great. And typically,
we had one of those that we dealt with, gosh, a few years ago now, a beautiful, gorgeous feral cat who never ended up moving in with us. She always lived outside, and she developed a fibrosarcoma. I mean, she must have been somebody's cat at some point. And it was difficult working with her, obviously, because she wasn't a pick-me-up or cuddly cat. So we had to be very careful about giving her remedies and find different innovative ways to be able to do that. And the tumor grew until it was really, really a very difficult one, the first one. But then it suddenly started to recede, and she went completely into remission. And it was almost 2 years later that, very close to the original site, it grew back. And at that point in time, she moved into the house. She became a completely normal cat with us. And she finally died of the tumor, if you're going to say she died of something. And it was a difficult journey for her. However, although the tumor itself broke down and it was really, really huge, and we wrapped it up, we wrapped her every day, her energy, her own vital self, remained absolutely beautiful, absolutely wonderful, right to the very, very last minute of her life. It never bothered her. She never showed pain or discomfort, and she allowed us to dress it. But 2 years was really, really good. I thought that was a really, really lovely journey. One thing that I would bring up too, and I'm sure you're both going to agree with me because we see it all the time. If somebody is given a prognosis, I mean, I saw this happen with my mum. She was told she'd have 6 months left to live. She lived almost 7 months. And I see it with doctors all the time, whether they be veterinarians or human doctors. Once a prognosis is given, it sits in the heart of the caregiver. And it's on, you hear these wonderful stories of a prognosis being given and then they live on for X number of years. And I have to wonder if those are the people who listen to the prognosis and go, forget that, let me just put that straight out of my mind. And yet other people will come and say, well, he was given 3 months to live, and we're getting close to that now. And you can feel they're sinking down into the depths of despair, and so everybody does. So I think that's something that's really vital, is to encourage people to just rise above this. You can do so much. And let's live in the moment. Let's enjoy every day. And let's be open to the route of healing, whether it's healing for continued life and getting well again, or whether it is time for transition. We can't actually know that. So let's just enjoy what we've got.
That's really true. Recently, somebody who I'd referred, since I'm now doing pet health coaching rather than treatments, one of my prior clients who stayed in touch with me, and I'm continuing to coach her, but someone else is doing the prescribing, was told by that good, very good homeopathic vet, oh, I don't know, we may be running into problems here. And she panicked and she didn't do well. And yet often veterinarians, even homeopathic ones, feel they need to sort of cover their ass and warn people that something bad might happen. So it's a line, it is a line that we have to walk sometimes, and it depends on the client. If we can educate them to be more like you, then it's wonderful and we don't have to do that. But some of our newer clients, sometimes we have to.
And
but I totally agree with you.
The reality, Christina, of medical care and veterinary care nowadays is we do have to, it's incumbent upon us. It's our responsibility to give all the information that's available to everyone that we deal with, or all of our clients or patients that are ill. And the reason I say that is because if you don't, and you say, well, homeopathy is the only way to treat this, and we're going to treat them and not worry about, you know, what the diagnosis is, or what the lab tests show, or if it's found, you know, if that same animal goes to the ER, let's say the vet ER, and has a problem, they're not going to be supportive of what you guys have been doing all this time. And if the owner, if the guardian is not already informed about what, you know, what the disease options are, what the disease treatment options are, if they're not already informed, if they're not prepared, you know, I've seen over 90% of people that are already treating holistically and homeopathically abandon that altogether because the vet at the ER told them that, you know, homeopathy can't possibly work, that what you're doing, that the vitamins, that the herbs, that the diet can't possibly have any effect, and that your pet has a bad disease, and you've got to have, you know, steroids or radiation right away, or else you're not going to be able to treat them. And I think Debbie is a great example of what happens when you do have all of the information, when you know what you're dealing with. Kedrin, one of her pups, was diagnosed with a mast cell tumor, malignant tumor, 6 years ago. But she came armed. Actually, I think we were treating her already at that point. And so she had all of her information. And I can tell you, because, you know, Debbie is 5 or 6 hours away, so most of her local vet visits are locally. And I can tell you, I'm sure that almost every time she goes to the vet over the years, they've said, you know, you've got to remove this. You've got to take this out right away. And now she's grappling with, do I remove it? Because it is gradually, over time, getting bigger, and we're seeing less of an effect from the remedies. So, you know, it's a hard thing. But Christina, I'd love to hear what you would tell Debbie as far as her question that she put in the chat box earlier, as far as, do you think it's time to remove it?
About removing the degranulating one, I actually said that. I asked her if she can tolerate, I said, if you can tolerate the degranulation, it's better not to remove it, just to push Dr. Jeff to see what he can do better with remedies. Sometimes clients don't push us. Sometimes clients sort of go, well, they said to wait, so I'm going to wait. So often,
waiting isn't doing nothing. Waiting means monitoring.
And responding to any changes that are happening, and also responding to no changes that are happening, and looking not just at the degranulation, but an earlier comment that I made was looking at the overall health level, energy level, emotional state, everything else that's going on, and not focusing on the lump. The other thing that, I haven't had a chance to say it yet today. The other thing I would do is I would get trained in Reiki, and I would offer Reiki every day. And that may stop the degranulation. The degranulation might be a good thing. That might be the tumor going away. I'm not familiar enough with the process of healing of them to know whether that's true or not. Something else you said, Jeff, I was going to comment on. I guess for me, you know, being a little more eclectic, if somebody came to me for coaching and they'd been going to someone I felt was a really good homeopathic veterinarian, and they had a lump that was slowly getting bigger, but in all other ways, the animal was doing well, I might think about looking at doing some herbal or neoplasine or something just to do some debulking of the tumor rather than surgical where you need anesthesia and all of that. But I'd look at maybe some other way that might help support the body. You know, I'd look at maybe doing some cannabis or some noni or some Hoxie formula, something like that. I'd look at something maybe that would address that specific tumor. If it was a tumor that had an individual blood supply, then shark cartilage could work. But the key thing of doing that is if you're taking on something like that, your homeopath has to be on board with it. And you have to be watching very, very carefully for other symptoms. Because if other symptoms are triggered, then you need to, that means the energy field is responding to the treatment you're doing and producing new symptoms that could be used to actually prescribe for the animal. So that would be my slightly more eclectic approach. Rather than surgery, that's what I would do.
But you brought up, I'm so glad that you brought up the question about debulking and neoplasty and all the other treatments that can have an effect. In addition to surgery, I think that we need to start by saying, you know, the definition of suppression cannot better be met than when you remove a tumor. I mean, suppression is you do something once and the symptom is gone, but the underlying process is still there and may actually get worse and create more problems. I mean, I had a great case that I mentioned a few weeks ago, a little benign eyelid cyst that, like Susan mentioned, you know, they rushed off right away to the vet and had it removed because that's what you do. And within a week, the dog was paralyzed. Now, a little benign cyst or growth on the eyelid being removed should not cause paralysis.
Yeah, no.
Yet those two things were temporarily, you know, time-wise, they were directly related. And when homeopathic medicine was given based on the individuality of that dog that developed the eyelid tumor, then the paralysis went away. So basically, by dealing with the underlying problem, we were able to deal with, you know, things that had been previously suppressed. But more importantly, and more to the point, I wanted to talk about the question that really is become more and more germane nowadays, and that is, does surgical removal actually increase the chances for spread of cancer? No takers?
It depends on the animal.
I know. And
There's that. I don't have that card. That's upstairs.
There is a lot of growing scientific evidence that actually the tumor, the presence of the tumor itself, is actually allowing the body to respond in such a way that it keeps it's monitoring it. It knows its location. It knows where it is. Once you take it off, the monitoring by the body goes haywire, and the tumor is free to spread anywhere throughout the body, because the tumor is not that one little growth that you removed or two little growths that you removed. It's a systemic problem from the outset. And the best quote, I think, that goes directly to that is by, again, a great homeopath was treating cancer and curing cancer at a hugely successful rate. What did Burnett say? That you can't cure an apple tree of growing apples by cutting off a limb. Because the nature of the apple tree is still there. And in fact, you know, pruning of a plant often greater growth. And that is basically what you can see when you take off a mast cell tumor, or in this case, little meibomian adenoma on the eyelid, or any other little wart growth, or like Susan's friend, who they had a little growth and they rushed him right off to the vet to get removed. So it's the cosmetic thing, so it looked bad. And that's why that goes back to why I think prognosis, or the long-term survival, is directly related to how long you're willing to live with the symptom, in this case with the mass, with the growth. But I also want to go back to and perhaps get a little more information, because Debbie asked, she said that she needs more information about removal of the mast cell tumor. And
no, she was okay. Once I answered her, she was fine. I think she was one that said she was fine.
Okay, great. Well, that's fantastic. Okay.
Basically, if you can live with it, be with it. The other point, though, I want to make, Jeff, is that the paralyzed dog is a good example that we often make decisions for various reasons. I mean, maybe a tooth is so rotten and the gums are so bad that you need to pull a tooth. They're not eating, they're in pain, they haven't responded to the homeopathic remedies. And you pull the tooth, and then a more serious symptom appears because that was, you caused suppression by pulling that tooth, but you didn't know that ahead of time. But it doesn't really matter, because if there's a new symptom, even if it's a more serious one like paralysis, if you can find the right remedy, then you're farther ahead. So I think the most important message is it's not as important whether you remove a lump or do not remove a lump as it is to be treating homeopathically before and long-term afterwards, not just post-surgery, but 2 years at least of close, careful following of homeopathy. Because it may take months before the new serious symptom shows up. It may not be right away. So therefore, you need to commit to really serious, good homeopathy afterwards. And of course, whether the animal can tolerate it or not. You know, animals mostly aren't bothered by most things. You should see Gail. Some of the cats Gail has had at her place. I mean, I would have thought, oh my God, this animal's on death's door. This animal must be in pain. The little cat that greeted people and moved from room to room. You know, he'd go from door
Same as Fraser, and he was 34.
What was his name? Fraser, yes. And people would come in, you know, he was like emaciated, and I think, didn't he have a lump or something? But he looked awful. Yeah, he just looked awful, and people would go, and then he would trot to the next door, and then he'd just sit there. But in spite of everything he had, he was happy cat. He was in charge of greeting people and moving them from room to room. So I think the point is, yes, we have to make the decisions for our animals, but there's no right or wrong decision. But most animals aren't in pain when we think they are. They're not uncomfortable really when we think they are.
I also think it's really important that how to make a decision as to whether to go to surgery. And the situation you were describing a minute ago is one that I have to say I'm really, really familiar with. We have over and over cats with really bad mouths. They get to 17, 18, 19 years old. They've got various chronic illness that they're living with quite happily, but their vital force is quite low. They're happy, they're doing well in daily life. Could I put them under anesthesia? The answer would be yes. His will to live is so strong, he's going to be fine. But very often the answer is absolutely not. And it's then that we really have to pull out the stops and figure out how to go forward to make the quality of life on a daily basis better. And once you're faced with that wall, of, oh my God, I can't do surgery, I've got to do something. It's amazing what you find you can do. I think it's also amazing the resilience of animals, and also Mother Nature. Very often, if there's a tooth that's bad, it's old, nothing's happening, it's painful, you're working with pain meds, whatever kind of pain meds you choose to use, and then the tooth drops out, and everybody goes, oh wow, and the problem's solved. So Mother Nature very often will step in and say, those rotten teeth, let's just get it out of there. And something will happen, and the animal's vitality comes back, and they're suddenly doing well again. And sometimes it doesn't have to be a tooth. We have a cat now. You may remember probably 6-8 weeks ago, just after Taka died, I told you I probably wouldn't be able to come to 1 or 2 blabs because Jonah was dying. Well, Jonah went right to the end of his life, and then he kind of stuck up a paw and said, maybe not. He's now just 4 pounds. He's eating quite well. He looks terrible. However, he's just a cuddle bug. He wants to be cuddled. He's got his routine worked out. He can walk again, and life goes on. So our animals can really surprise us. Most people would have euthanized him a long time ago, but he's happy. He's really happy. He's just living in a frail old body that is barely strong enough to support him, but he himself is strong. And so I think it's another reason where we have to look deeper than what we actually see when we're trying to evaluate what to do. We have to look at every single little aspect of what's going on with the animal. But
and also, remember that Gail does consultations. And so if you know people who are wrestling with these decisions, have them call Gail and do a consultation about this. It helps support the Brighthaven. And also, she's got this wide range of experience that she can do. And then also I do the I do the consulting to help you get set up with a vet and all of that. So, either one, but Gail, particularly for that area.
I think very often when you're faced with something that's, it can be helpful to have someone like me or anybody else that has the same kind of experience. Your veterinarian or your doctor has given you all the information. So you've got it all written down, you've understood it, you've asked questions, you've maybe done a second diagnosis. And then you sit at home with your family trying to figure out what to do. And at that point, it can be really, really helpful because you have so many people telling you, you should think about this and you should think about that. And what about that? And, oh, you can't do this. It's such a difficult journey to make those decisions. So, yeah, I think it's really, I love doing that kind of consultation because whatever their question, I've been there, seen it and done it. And just having someone's shoulder to lean on can be so important at that time. So important.
Yep.
I just wanted
Absolutely. One thing that I recommend for all of you that are doing holistic.
Jennifer was asking about the baby, and so our baby is due at any moment. Any moment. Blanca had a baby just over a year ago, and she was actually here working until her water broke. She went into hospital and the baby came 6 hours later. So this could be she could be getting a car at any time.
I'm having a baby now.
So one thing, Gail brings up the support issue. And I really encourage everybody, and I've been running into this recently where it was really needed and they didn't have this set up ahead of time. Try to find somebody who's on the same wavelength that you are. Through Facebook groups, through this group, through just putting it out on your personal Facebook. Find other people who are at the level you're at or a little more holistic that you can be friends with, that you can chat with every day, that you can chat with once a week. When decisions come up, you've got somebody already there who knows you and who can, you say, I'm going to the vet, come with me. Maybe they can come with you to the vet and help you navigate if you're going to a conventional vet, or even if you're going to a holistic one. You know, sometimes holistic vets have a bad day. We're not all perfect by any means. And you need to be, you're the one that's the advocate for your animal. So, but it helps sometimes to have another one with you, especially if you're like so used to accepting everything your vet says, and today it seems like they're way off base, but you don't want to tell them, hey, what's wrong with you today? And, you know, but if you have a friend with you, the two of you can sort of look at each other and go, well, let's ask some different questions, or let's
and that is, you know, so important, is that support. And that's the reason we're here every week, is to provide that kind of support for you guys. And that's the reason why Christina does her classes, why Gail's doing her consulting. I'm going to be starting, actually, I think our first group class is going to be a week from this weekend. And that's the main reason that we're doing that, is to provide as much information and support as possible. Now, most of my clients know that if they email or text or call, that they're gonna get an answer from me, you know, certainly within hours. And yes, Christina, not everyone has a vet that they can work with that can help support them that way. And they can often find somebody on Facebook or elsewhere online. And that's, you know, that's what I'm hoping that all these online ventures are going to promote, is to increase or help everyone treat more naturally and holistically and homeopathically. And the reason they're going to do that is because we're going to be here to support them throughout any of their decision making, provide all the information. I mean, I may talk about the conventional diagnosis or how you make this or that, but you're going to then turn around and say, well, you need to be doing Reiki and praying over the water. And that's, you know, that's exactly
right.
why we're here. And that's why, Gail, you have such success with all of your charges, I think, because they know that they're in a supportive environment. You talk to them, you love them, you nurture them, and you are providing the support that they need to live a good life and heal. And hopefully we can do the same for them, for ones that aren't living with us. So there's a lot more that we can say about cancer and other serious diagnoses, but I do see we're out of time. And is there anything else that anyone wants to bring up? Any other questions? Anything we didn't address?
Well, I just want to add that when you're choosing the holistic approach, you are helping the planet as well. And Mother Earth really appreciates everything that we do for her. And so just that's one other little added benefit for choosing the holistic modality. And I've got one thing to say.
I'd love to tell everybody that we're actually releasing the first module in our education program on August the 1st. So next week, our first one goes on. We'll be sending out a constant contact and posting on Facebook. And so hopefully everybody will tell everybody. And it's really all about, this first module is about our menu for healing that we call the Love Sandwich, just explaining what it is, what kinds of modalities, what we do, and how we got there. It's all about my journey from a very conventional background into this strange world that I live in now.
Well, that's exciting. Congratulations. I'll look forward to watching it.
Good job, Gail.
And so I'm Jeff Feynman, that's Christina Chambreau and Gail Pope, and we're signing off for this week. So thank you all for coming. Thank you, Gail. Thank you, Christina. We will talk to you next week.
Bye-bye.